Hi, I'm Vibha, a psychologist, a storyteller, and a mother. And I'm sitting with somebody truly extraordinary, Dr. Anita Murugesh, a plastic surgeon, cosmetic gynecologist who helps women not only heal but also reconnect with the most intimate, powerful parts of themselves. Hey, we have a few questions lined up just for you. Shall we begin? Okay, to start off with, as a doctor and also as a mother, what was your own experience of motherhood?
Hello Vibha, I'm happy to welcome you today. I've been always wanted to do this with you. You've been an inspiration as well as a role model for me right from my childhood. You've been the best whom I can actually call for a Mother's Day. In fact, as a mother, I have suffered. I was a student then and I was going through a lot. Specifically, I had put on a lot of weight. I had to shed a lot of weight to also continue with my post-graduation training. So I did go through a lot. I want to know what all you want me to talk about.
Anita, to start off with, my first question is, what are the usual physical and emotional changes that women notice after childbirth?
Okay, physical changes that usually women try to put on a lot of weight. It's a tendency, and usually being Indians, we try to put on more weight because basically our mothers tell us that only if you become completely chubby and then the baby puts on a lot of weight. So we are completely having a big belly after pregnancy and after childbirth, and we have those breasts which is like completely tender, huge breasts, and then like also the vagina which is completely stretched, be it after normal delivery or the stretch marks. So there are a lot of things which women go through after childbirth.
I think another biggest concern over here is that women feel very disconnected with their bodies after childbirth. You don't recognize yourself, and why does that happen?
What happens is when we are actually looking at how much of weight we have gained, we actually have lost the body which we were there. We had a small silhouette. Suddenly we are looking ourselves at a bigger thing, and we no more have that figure which we always had, and suddenly you say that this is not me, and then there's a loss of confidence completely. As a psychologist, how do you deal with these particular women when they come to you? They are going through a lot, be it postpartum blues, or they don't want it, they don't like it anymore. It is just not the part, it is just not about the kid. They've lost the interest of them completely. So how do you deal with these women?
I think step one is to be able to recognize who you are today. Recognize the woman who's staring at you in the mirror and get comfortable with that. Because we all love the past, and there's a reason we hold on to the past. But we have come here with all the scars of all the battles we have fought, and I think motherhood is such a beautiful experience. So the step one that I think we all encourage the women who come to us is to be able to recognize who they are today for all the strengths and the scars that they carry, and embrace it. Truly embrace it through various methods that we have, but truly embrace the person that they have become today.
And you tell that you have to embrace, it's the same thing. I just want you to know that once we stop believing that we will not be able to shed that weight, then yes, of course, you're not going to shed. You look at all the actress or anybody, just not the movie industry, even you look at the sports field, they have to get out of the motherhood. I'm not telling that it is not motherhood. They continue to be a mother as well as they continue to carry their career, which we lose at one point of time. So to continue the career point, we have to realize that we have to shed that extra weight or whatever is bothering. So it's time we step up and maybe get a help from either of you or me. Maybe if at all it's emotionally disturbing them, then they probably have to come and speak to you as a psychologist. So you will definitely be there to help. And when it's something like they're really not able to shed a weight, or when there's something which is really bothering them, be it something like a loose vagina or a loose tummy, or they're not even able to shed their weight, they probably can talk. It's no more, we do not live in a past generation like probably 20-30 years ago where we didn't know what to do, where your mother would just say that wear a tight turban or something and then it's all going to get in. No, it's not. There are more. There's so many Kegels exercises, there are so many exercises. At the end of it, when we have to get it, we need an expert advice. I'm not telling that you should just go to the expert, but when you look at the YouTube, there's a lot of things, but you don't know what to follow. Some say that this is the right thing, and then there's the other one who comes and says, no, this is the right thing. But are they really qualified to talk? No, I don't think. See, that's why I asked you. When a woman is emotionally turmoil, when they sit and talk to you, probably for even 10-20 minutes, there's a lot of change in them. It's the same way when you go to someone who knows something about the topic.
Really happens after a vaginal birth.
Of the women, after the vaginal birth, basically what happens is they have a urinary leakage. So mainly this happens because the child will be sitting on the neck of the bladder. So mainly because of this, what happens is sometimes they end up with urinary incontinence. Urinary incontinence is something like leakage of urine. Some of them you would have heard, they say that while they sneeze, they have a mild urinary leaking. This is one of the first things which women usually encounter after childbirth. Next, the laxity of the vagina. It is completely stretched out. Basically, what happens is it's a baby which is coming out through that vagina. So yes, the vagina has to stretch to that extent to make that baby come out. When the baby is coming out, it is okay. But after that, the women doesn't feel that whatever pleasure she felt before or the tightness she felt before. Also, sometimes we have that episiotomy which is happening. That is the cut which happens after the childbirth. Once when there is childbirth happening and there's a cut, usually most of the women do not even tell it, but they suffer silently. Basically, what happens at that point is this pain, and they will not even be able to go to their, basic washroom things because they have pain and they cannot tell it to anyone. And then the next thing is, okay, after the childbirth, it's completely stretched, and then they do not want to have intercourse because they don't feel it anymore. All the complexion of that, maybe, I should, I should do something, but then they don't know what to do. So we can definitely do something about it. That is why Kegels comes to play. That's why we usually say that you have to do Kegels just after your delivery, and it's a must. Every woman should do. In fact, Kegels will even help to strengthen that bladder thing, laxity, whichever we had. It will help you strengthen with that also. Kegels helps you in strengthening the pelvic muscles completely. So it's a must that we have to do Kegels after surgery.
What about C-section recovery? What should mothers know there?
After C-section, the whole world gives you a taboo that you're not supposed to do that. They end up with being sitting in a couch for a very longer time, and it's all they do is just feed the baby and then do minimal activities. I think that taboo should go back. Section wound, it will completely heal by 2 weeks. The internal suture actually heal, maximum it will heal by 3 months. Afterwards, I think everybody, be it a normal delivery or be it a C-section, they should start doing a little exercises. That's the first thing which they have to do. And next, after C-section, there's a wound, and then you are like freaked out, that small thing. Your body has so many stretch marks. This small wound is not going to make a difference. And the stretch marks is basically what has happened is the skin is stretched out so much that there is a loss of continuity of the skin at that particular area where that has become a dent, and because of which you have a stretch mark. So when such a thing has happened to your whole of lower abdomen, you're just bothered about a very small scar which has happened just below your bikini area. So why are you so bothered about that small scar? You can completely work out. Even if your scar stretches out, which is like completely rare, still you can continue to do whatever you want. So basically, I would tell every woman, go on with your diet, go on with your exercise, which is a very must.
Okay, so you did talk about incontinence, you spoke about vaginal laxity, and this was the scarring, right? Like, do these things ever go away? Is there a way for all of these things to like completely go away, or do you always have to live with it?
Stretch marks you are basically talking about. The stretch marks, eventually we should have avoided it. Unfortunately, most of the women, they do not even know it. So basically, it's the stretch of the abdomen. Like when you suddenly gain weight, and basically what has happened is in that particular area, the skin has stretched out. There's 2 layers of a skin. One is the epidermis, and then there's a dermis. The epidermis is more of a dead cell. And then there's dermis, which is again 2 layers. One is a papillary dermis, and then the reticular dermis. Too technical, but then very simple. Anything which happens to the reticular dermis, that is the deeper dermis, will always heal with a scar. So when your skin is rapidly expanding, yes, the upper layer is expanded, but the lower layer cannot expand to that degree. So what happens is it is expanded to some extent and then it's not able to expand. Now your upper layer is falling on it. That is why you have that stretch mark. You basically touch any stretch mark, you have that discontinuity of the skin. And one thing you could have done, probably drink plenty of water, which could have aided you even before getting these marks. And then, you could have applied a lot of moisturizer. Probably it would have helped you moisten in that area and give you a little hydration to that particular area. Would have maybe prevented a little stretch mark. Now, if you ask me if that stretch mark is going to go, if it is already formed, we can just camouflage it. That can reduce the extent what it is seen with maybe a little laser here and there, if at all it's needed. And if you look at the C-section scar, have I ever come across a hypertrophic scar or a keloid scar? So if at all there's a hypertrophic scar or a keloid scar, you can basically go and consider talking to any plastic surgeon. They will definitely help you with managing this, keloid or hypertrophic scar. Other stretch marks, yes, there are a lot of things which we can do, but mainly, yes, lasers can help you camouflage it. But definitely whatever damage has happened cannot be repaired to a very great extent.
What about vaginal laxity and incontinence? How do we deal with that?
Incontinence, it could have prevented with a little Kegels. It's not late to start Kegels anytime. In fact, if you actually do a Kegel even now, I always tell my patients, please do Kegel, because your pelvic floor muscles always needs these exercises. It's a very good exercise. It's a very nice practice to always do that, because once it's not just about childbirth. Every day that vagina is going to be stretched, be it intercourse or be it the period shedding or whatever, it has to be stretched out. So eventually, if you do a little Kegels, you feel way better than whatever it is. It is like you're not atrophying something just because it's not used. So Kegels is a very, very good thing. Next, coming to what happens if there is urinary incontinence. So if they have a severe degree of urinary incontinence, then we really can't do anything. They have to go to a gynecologist. But if it's something like grade 1 or grade 2, like only while sneezing they're having, then definitely we can help them with just not Kegels and a little bit of, even PRP is going to work along with, a laser. It just makes new collagen formation. So eventually it tightens the vagina. PRP, yes, it's a stem cell therapy, that there's too much hype. Yes, it does the same thing even in the vagina. In fact, few of them who have lost the sensation around the vagina after childbirth, definitely PRP as well as, laser can definitely help you. In fact, what laser does is it's just not with, the laxity, it also helps you with incontinence. The laxity and incontinence when someone has, it's a very good time and thing to consider about, a laser vaginal tightening.
So what are the most common cosmetic gynecologic procedures for mothers?
They come to me is for laser hair reduction, okay, specifically to that bikini area, and then hyperpigmentation. Usually it just becomes a little more after childbirth, and then you look at the minora, that is basically called the inner lip. The inner lip tends to become a little more bigger, or even if it is been before, suddenly they start noticing and they find a lot of discomfort, be it during intercourse, during the normal time. When they wear something tight, they feel it very uncomfortable. So that time they suddenly want the reduction to be done of the inner lip. And then specifically for urinary incontinence, grade 1 and grade 2. And then you have the biggest thing, the loose vagina. When they want the tightness back, they do come to me. Also for, augmentation of G-spot and O-spot. It's not specifically for that. They would have lost sensation, so they do come to me for PRPs.
So what is vaginal tightening or laser regeneration? Is it safe?
When you look at laser vaginal tightening, most of the lasers will be exactly targeting a specific molecule. Like mostly it is water molecule. So when it is water molecule, basically what happens, it is just the mucosa, it has water molecule, it is just concentrated in that area. So it's not going to damage anything other than that. So it's completely safe and very specific to that particular area only. Rejuvenation is like complete, getting the sensation back and everything. Both whatever, whether you consider tightening or this, both of it will give you a better sensation, tightening, as well as it has a good effect also on urinary incontinence.
Mensplasty, who usually opts for it?
A few women who put on a lot of weight, and they do put on a lot of weight exactly at the pelvic area. So it's too big. They cannot even see their private parts by themselves. So suddenly it is all big. Either it is just, hanging down, or it's too big. So either we actually have to do a liposuction to that area, or actually have to lift it up. So this is basically onceplasty.
What is labiaplasty? Like who goes for that?
There are a few women in whom the inner lip is way bigger than the outer lip. So what happens in this women is, basically it's a mucosal structure. So when you wear something very tight, they find it very uncomfortable, and they might not even show it in their face, but it's something they're struggling inside. So it's them. And then next, there are these women, when they're having intercourse, they will not even be able to find out the vagina because it's so covered because of the inner lip. That is when it is really big, way beyond the outer lip. It has to just show out of the outer lip. When it is beyond that, then they consider labiaplasty.
We're coming to something people want to call myth, all of that. G-spot, O-spot. Does it even exist?
It's a controversial thing. Basically, G-spot is it has too much of nerve endings in that particular area. So there are few women in whom G-spot is like, they do tell that they have that wonderful orgasm when they stimulate the G-spot. But then there are few women who say that I do not get anything. So it's still a controversial, but I have seen women who tell me that yes, I have got a difference. I also have this women who say I have no difference. And if you really want to know if this woman is going to be benefited, you can directly ask her, do you have that orgasm? Only then there is intercourse. Now coming to O-spot, O-spot is not anywhere else. O-spot is something around the clitoris. So we usually stimulate that area. Few of the women actually, they do have orgasm contact with each other. So basically the friction causes the orgasm. So in those women, O-spot is better, and it, when you stimulate that, they be happier, or specifically they have a better sensation.
I think one common thing which everybody notices is your tummy. What do we do about the tummy?
Look at the tummy front. So what happens is, you had that baby in your womb for such a long time. So you have few of the muscles called the rectus muscles. So it actually stretches out. So there is something called as divarication of the recti. Basically moving a part of the rectus muscle. Loss of tone of these muscles as well as that big bulge. So I specifically told you that exercise is a must. Exercise does help you with, even if there is a little divarication, it might help you with getting that tone back. Whatever you do, if your tummy has gone stretched back to that extent where it is just hanging, we cannot do a lot. You will have to go for a tummy tuck. But then I would really be happy if a woman with a lot of stretch marks, when there is a tummy hanging, they always have too much of stretch marks. So they might go for a tummy tuck. Tummy tuck is basically like the loose hanging tummy, whichever is there, will be completely flattened out with a small, yes, of course, you have a C-section scar. It will be a little beyond that C-section scar, and we cut out that particular hanging part and we stitch it back, and it gives you that flat abdomen, probably which you always dreamt of.
In pregnancy, I think you have the most amazing breasts. And then eventually you're feeding, you stop feeding. So most often the breasts lose their volume, and they sometimes also become saggy. What do you do then?
You were telling me the breast looks amazing during breastfeeding. That's mainly because there's fullness in the breast. So what happens after you finish breastfeeding? Mainly, either the women loses the volume, and then there's some other women whom they have sagginess, and then there's another lucky people whom you may say that they do not have any change. So for the first two category, when they have lost volume, yes, you do not have too much options, except that probably you have to consider a fat fill. Like fat fill is something like you take your own fat and you use to fill that breast, which is deflated. Or you can go for implants. Implants do give you that amazing look. Even fat will give you that amazing look which you actually thought of when you were breastfeeding. And then coming to the women who have that sagginess because their breast was too heavy and then it's saggy. So now what do you do? So we do have options called mastopexy. So mastopexy is something where you actually lift the breast. In that conditions, it depends on how saggy it is. If it's very mild sagginess, you might not even have any scar or anything. But then if it's more than a certain extent, then you can lift the breast, but with a little scar marks here and there. But remember this, none of these scar marks are going to disturb with any of your dresses. It's all going to be below the nipple areolar complex. So it's not going to disturb anyway. But then if you really bother about the saggy breast, then you might have to consider lifting up the breast. It's called as
About adding your own fat, and you also spoke about implants. Are implants safe?
Is implant safe? This is a usual question every woman asks me. So when you look at implants, usually the doubt which they have is, will they get cancer? Yes, there are a few cases of cancer which is noted, but you also have to take to a point that you haven't got a mammogram in ages now, or probably never got it done. It's going to be the same with most of the women. But after an implant, you usually go for an annual mammogram checkup. So when this happens, even if there is a cancer, it is going to be detected very early, and the chances that it is going to be cured is way, way, way higher. And yes, I'm not denying you that it will never cause cancer, because there's like 0.01% of the population where they have got a cancer after implant. But when you're looking at the wider picture, like be it their silhouette, or be it the way they look, or be it the confidence, I think that the cancer part comes down, and then this takes a better step. And also, whatever you do, you're never going to get that perky breast which you actually dream of. It is always with an implant which gives you that good look. And also, women, next thing they ask is, do they have to keep changing their implants? Not really. If you are planning for another baby, then there might be a change of shape or anything. Other than that, usually implants are safe and durable.
Yeah. So you spoke about vaginal tightening, and my question is, we have surgical and we have laser. Difference in who opts for what?
The vagina is stretched to that level where the levator ani muscle outside the vagina. So if that has lost its capacity, or when the muscle outside the vagina has lost its capacity to contract, what happens is, these are the candidates who are ideal for vaginoplasty, that is surgical. And also when the looseness of the vagina is beyond certain extent. Probably I can tell you when I see them, but ideally it's more than 3 or 4 fingers, then they're not going to be better done with a laser. It's better done with a surgery. So what is mainly the focus is, I generally ask my patients is the problem with you or your partner? That just roughly gives us the idea what actually has to be targeted. And also depending on how loose it is, whether I have to go for a laser or whether I have to go for a surgery. So when the woman says that she doesn't feel him anymore, that means the vagina is stretched out to a very great extent, and also the muscle around the vagina is not working. So I usually tell them to start their Kegels as well as consider vaginoplasty, because that will help them tighten the muscle. So if they say the partner is no more having that tightness, it usually means that the outer ring is completely dismantled. So you will have to repair back all the muscles, like a pulley, too many muscles in one point. So we have to repair all that muscles for the partner to actually have that feel which they had even before their childbirth. So these are the factors which I usually consider, like who is actually having the issue and how loose the vagina is. Depending on that, we decide whether it is a surgery or whether it is laser.
And then when we're talking about this, right, what about vaginal dryness?
I have a younger lot coming with vaginal dryness too, but it's mostly a problem of a little older generation, not older generation, older people, somewhere beyond their menopause. That's when they usually have dryness. So dryness is specifically because of too many reasons, mainly because the hormone goes down and stuff. As I told you, PRP is a wonder thing. It really, really works very well. The dryness, I have seen a lot of women be happy after PRP. Also, laser to some extent does give you that, it makes that collagen remodeling and everything. So I usually combine laser with PRP.
Spoke about, tons of things today, and I think a lot of information even I did not know. And I am sure there are a lot of women out there who do not know about it. So why exactly is this? Is there a lot of judgment or stigma, associated with coming to a doctor and actually talking about your intimate things? Or even for patients who come to you for various procedures, are they afraid of, people judging them or some sort of a backlash?
I really want to tell you, like how you didn't know. I was a doctor, I was a plastic surgeon, but then I didn't know most of the things. It took me a leap forward to become a finish my fellowship in cosmetic gynecology to actually know the basic things. So I do think that women ourselves, we don't know much about us. We do focus on too many things other than our intimate health, other than what is needed for us. We do concentrate on something which is happening beyond our scenes, but not many doctors are speaking about it, or there are not many things which actually is there on the internet to actually encourage the women to come for it. And also I feel that women do not have that knowledge where to go and what to do. So if it is there somewhere that it would be helpful. I'm trying to bridge this gap a little here and there. That's why I'm actually into this. And then coming to the stigma, usually a woman who's confident, who knows she's going to get this procedure, she's okay. But then there is the other part. You have a partner. In fact, I had a woman whom I had done a vaginoplasty. He told me, like, ma'am, my husband was asking me, did your doctor judge you? See, we are not here to judge anybody. Your body, you know what is best. I am not, how much of I'm going to tell you that this is going to suit you, you're not going to take it until your brain tells you that this is right for you. That is when the womenhood into them comes to play. But unfortunately, if we know a little more about ourselves or about our intimate things, then I think, we will go a little more forward with whatever it is. Yes, I still feel that too many people find it very shy to talk to me about the intercourse part of it. They even actually, I have asked women, when do you have an orgasm? And some of the women are like, they sit and think like as if it's a taboo. No, it's not a taboo. When a man speaks about orgasm, when a man speaks about masturbation, I think women also can speak about orgasm. Yes, orgasm is important at the end of the day, but we do not give so much importance to anything. We just think satisfying a male population is all we need. At the end of it, it is not that. I think as a forefront, we have started working, we've started coming up. I think this should also come up. This should also, everybody should know, yes, we can do these things, we can get rid of all of this. So yes, what I want to tell the women out there is, know what you know. And if you don't know something, please ask someone who knows and not people who don't know. So I always tell everyone this, don't be scared. Nobody is going to judge you. No one out there is even going to know what you've got it done, because it's something inside you, and you're gonna walk normal, talk normal after you do these procedures.
There are a few women who really hesitate to wear sleeveless clothes, probably because they have some sort of swelling near their armpit. What is that, and is that something that can be treated?
Axillary breast. What it is like a breast tissue which is present near your axilla. Axilla in medical term is armpit. Okay. So what we can do is, we can do a lot of procedures. Basically a liposuction or liposuction with excision of the breast tissue. It's a very simple procedure, can be done, in a daycare procedure. If at all it's bothering you too much that you are not able to wear the clothes which you like, then it can be treated. It's just not that about the clothes. There are a few women whom it's so painful. They actually have an excruciating pain. Definitely it can be treated in a very, very simple way.
We covered a lot of topics today, but there is one thing which I'm sure a lot of people also want to know. The affordability, the accessibility. How affordable are these procedures?
Look at the affordability. It is not very costly. Once when you go to your parlor, you're going to shed out like something around 5 or 6K. Probably most of the procedures, like all this small hair removal, PRPs and everything, is going to just cost you around that range only. When you look at a vaginoplasty or any surgical part, that also is not that, you have to shell down beyond 1 lakh or something like that. Only when you come to a mommy makeover or something, it will go beyond 1 lakh. But then other than that, if you are considering a laser vaginal tightening, it is still in your budget, which is pocket friendly. And the best thing about all of this is, it's just monthly once. So even if you actually have to repeat it, you still gonna have that money which you can actually spend. And I am sure the present generation women, they do spend more than 10,000 on their regular activities. Like when you go and shell out a cream which you don't even know it's going to work, and you're okay with that. Sometimes you spend up 2,000, 3,000, but you know these are going to help you in some way. That means you can still spend another few bucks extra. It can work. So it is really affordable, and if at all you think that the surgery is a little costly, most of the centers do offer EMI options, and yes, so it is very much affordable. Something beyond your budget, trust me, you can still save the money and consider doing it after a few months.
Thank you, Dr. Anita, for taking the time out and helping us, get this wide array of information. I'm so sure I had no idea about a zillion things that we covered today, and I'm really looking forward to talking to you again. Thank you.
Thank you, Vibha, for coming. I have not told you this for a very long time, be it my pregnancy weight or be it before that. It was you who motivated me to lose weight. I'm sure you don't know this incident, but then once you actually told me how important exercise is, I actually got that journey from you. I'm always grateful for you, and you light up most of the people's life, and I'm very happy about that, and I'm very, very happy to have you on Mother's Day and to enlighten such a good topic. Thank you, Vibha.